Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Blood pressure is the force exerted by circulating blood against the walls of the body's arteries, the major blood vessels in the body.
This is what we call vital signs. Vital signs. Whenever you go to the hospital, there are some findings that they do that show that your body is functioning normally. Yeah, and one of them is what? Is the blood pressure. So just for that reason, whenever you go to the hospital, you should make sure your blood pressure is what? Is measured.
Blood pressure is written as two numbers. The first, or systolic number, represents the pressure in blood vessels when the heart contracts or beats. The second, or diastolic number, represents the pressure in the vessels when the heart rests between beats.
Systolic is the upper figure, and then the diastolic is the lower figure. So the normal range for the upper figure is 90 to 119 millimeters of mercury. Then the lower one, the normal one, is from 60 to 79 millimeters of mercury.
Sustained or consistent high blood pressure leads to hypertension.
What we call prehypertension, where someone's risk of developing real hypertension has increased, and that is when you have a systolic range of 120 to 139. Then you have a diastolic range of 8 to 89. So when the pressure is 140, the systolic range is from 140 to 159, and the diastolic range is from 90 to 99. That is what we call stage 1 hypertension. Stage 2 hypertension is when you have your pressure greater than or equal to 160 for the systolic, and for diastolic greater than or equal to 100. The higher the pressure, the higher the chances of developing complications. The ones we talked about, myocardial infarction, heart failure, stroke, kidney disease.
He also explains how the measurement for blood pressure should be done for accurate results.
We have what we call the cuff, the baby cuff that you wrap around the bicep. Usually it's advisable to wrap it around at least 3/4 of the bicep region. Yes, and it's advisable to put on the skin, not on the clothes. And also, to get a better reading, it's advisable to put it on the less dominant hand. Before we label someone hypertensive, or we consider them to have high blood pressure, we don't consider it on one reading. Yeah, you need to take readings on 3 visits to the hospital, 3 visits that are separated by 2 to 4 weeks. When you find the pressure high in all those visits, then you can make you can conclude, you can make a diagnosis of of high blood pressure.
Studies by the World Health Organization show that an estimated 1.13 billion people worldwide have hypertension. Most live in low and middle income countries. In 2015, 1 in 4 men and 1 in 5 women had hypertension. Fewer than 1 in 5 people with hypertension have the problem under control. Hypertension has modifiable risk factors, including unhealthy diets.
Basically, hypertension is classified in 2 categories. We have what we call essential or primary hypertension, where usually the cause is not clear, but usually it is related to genetic predisposition. Still, under primary or essential hypertension, it should be related to the environment. And also, I think this has to do with the lifestyle and what you eat and what environmental factors, and that accounts for the majority of cases of high blood pressure, about 90 to 95% of cases. Then the second category is the secondary. It's called the secondary hypertension. Here, usually, you can be able to identify the cause. Can be able to identify the cause, which could be maybe a kidney problem. Kidney disease is one of the causes of high blood pressure. It could be a vascular problem, or in the layman's language, blood vessel problem.
Dr. Matovu also explains how to manage hypertension.
When you reduce your weight, you're reducing the risk for what? for high blood pressure. Then the second lifestyle change that can help manage blood pressure is what we call salt restriction or sodium restriction, because excessive sodium consumption is one of the risk factors for high blood pressure. Limit alcohol consumption. Yeah, excessive alcohol consumption is another risk factor. Do at least 30 minutes of physical activity daily to contribute to managing what? To managing or preventing high blood pressure.
The prevalence of hypertension varies across regions and country income groups. The World Health Organization African region has the highest prevalence of hypertension at 27%, while that of the Americas has the lowest prevalence of hypertension at 18%. One of the global targets to reduce non-communicable diseases is to reduce the prevalence of hypertension by 25% by 2025. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.